anything at all about Paget's disease? Okay.
What year was the association formed?
Yeah, the association was formed in 1973 because a gentleman called Alf had Paget's disease. So he lived in Manchester, and that's why the association is based in Manchester still. His wife was a lady called Anne Stansfield. She's the founder of the association, and basically she set off the association from her front room with a typewriter, writing letters all over the world to hospitals and universities, basically trying to get information to help her husband. And from there, some doctors came along and helped her. She ended up in with an office in one of the hospitals in Manchester, and I guess the rest is history.
Well done. Anything else? Yeah. Do you want a microphone? No. No. Keith first, and the young yes. Come in, Keith. I knew I could rely on you.
We talked about the faulty gene quite a lot today. Is it that everybody that's got Paget's here has got that faulty gene?
Okay, who wants to take that one?
I'm happy to
Are
take
you?
it.
Okay, go for it, Rob.
So, absolutely not. No, it's really very important that we say that, because obviously there are implications for genetic disorders. So no, mutations are rare in Paget's disease, and I think you would know if your family had a familiar mutation, because it runs in generations. So most people are what we call sporadic. They don't carry these mutations, they don't carry these faulty genes, but from an experimental point of view, we study them because they're often exaggerated forms of the disorder, or they're easier to study or to model in our experiments as well. But the simple answer is no, that's not the case. But it's the same disease though, I think.
You had a question down there. It's good exercise, this.
Does Paget's disease only occur in humans?
Do you know the answer? Go.
You should know this, Lizzie. Well, there are reports in the scientific literature, starting with a Jurassic dinosaur, that shows imaging changes consistent with Paget's, and I think we featured that in one of our one of our magazines a year or so ago as well. There are anecdotal reports of Paget's-like changes, I think, in dogs as well, and there was some unusual vertebrate that I can't quite remember what it was within the last 6 months or so, reported to show Paget's-like changes. They're certainly not very, very common in animals, despite extensive searches for them, I guess. So, in rare cases, there are things that resemble Paget's, but diagnosing Paget's in animals is almost as, well, it's probably more challenging, I guess, than diagnosing Paget's in humans as well. So we probably wouldn't learn a great deal from them, I think. Unless anyone else knows any other animals that I've missed. A snake, actually, there was a snake reported to have Paget's once. Which isn't great when you're a snake, I think, it's, I'd imagine.
Can Paget disease affect the eyesight? Is it possible?
Peter, you're going to answer?
So Paget's disease can cause expansion of bones, and it's much more common, although still rare, that it would affect hearing rather than eyesight. It's unlikely that it will affect your eyesight unless there's a disease around the optic nerve, which is very, very rare. So it's more likely to affect hearing rather than eyesight. I've not seen any cases where it's affected eyesight.
No, I haven't either. No, I've not come across any cases affecting the eyes. I mean, in theory, it could affect any of the nerves that come out of the skull if the skull expands. But I've not heard of any cases affecting the eyes. When we did the guidelines, we went back to the literature all the way back to about the 19th century, we didn't come across anything about that. Yes, sir.
Could any of the treatments affect prostate gland?
Peter, you want me or me
No,
to?
you could do.
Okay, all right. No, is a short answer to your question. There's no association between prostate cancer and Paget's disease that we know of. That has in fact been looked at. There isn't an association between the two. I have had the odd case where you've had people with prostate cancer and Paget's disease in the same individual, and I had one person who had actually had to do a bone biopsy on. One of the few cases I've done bone biopsies on. He had a very high level of something called PSA, which is the marker for prostate cancer, and he also had Paget's disease, and the changes in his bone looked typical for Paget's, but there were a few bits that didn't look quite right. Anyway, in the end, we actually biopsied his bone, and he had both in his bone. He had prostate cancer that spread to his bone, and he also had Paget's disease at the same time. But they were much more complicated patients. The zoledronate we use for Paget's disease is also used in prostate cancer to help treat bone involvement in prostate cancer, but not because of the relationship between the two.
So, we hear a lot about a healthy diet. Has anything been looked into various foods that might be beneficial, sort of people who are vegetarian against people who eat meat? Is there any connections? I know that people with eyesight, they say more spinach and things like that does help. Is there any investigations going on foods?
You keep signalling it.
No, that's right. Yeah. So there is no evidence that any diet would reduce Paget's disease or any associations between certain diets and Paget's disease. There is an association between Paget's disease and hyperparathyroidism, where the parathyroid glands become overactive, and that might stimulate Paget's disease. So it stimulates all bone cells, and it would also stimulate the Pagetic cells. So the only deduction that we could make from that is that, as with any other bone disease, it's always very important to ensure that you have adequate vitamin D on board, as to not stimulate parathyroid glands, and also not to have any effect because lack of vitamin D would increase your parathyroid activity. But there is association with hypercalcemia, high calcium, and then also hyperparathyroidism with Paget's disease. But it's all just association. We do advise our patients who have treatment for Paget's disease to make sure that they have adequate vitamin D replacement. And if somebody has Paget's disease and they've been successfully treated, we advise them to not become vitamin D deficient, because we are concerned that anything that might stimulate bone growth or might stimulate bone turnover, such as the parathyroids going overactive, might lead to reactivation of the Paget. But there's again, we're in an area of very little evidence. It's just general bone health, but no specific diets.
That's right, and also we have to bear in mind, if we are treating Paget's disease, we're using bisphosphonates. They work best when you've got enough vitamin D on board and enough calcium. And if you're using zoledronate, it's really important to make sure the vitamin D levels are quite okay before you give it, because otherwise you can drop the calcium level. We worry about that one. Rob.
So I was just going to add another curiosity from Norton Priory, a historical perspective. It's been possible to reconstruct the paleo diets of the individuals at Norton Priory, so essentially work out what their diets consisted of. And they certainly were not undernourished. They had very high status diets, to the point that they resembled the diets of Richard III. So they had an awful lot of fish in their diet, marine-based diet, and so there's really no way those individuals were deficient in vitamin D as well. So there's no lessons there, I think. we initially thought, oh, perhaps they're malnourished, but absolutely not. It was the other way on, if anything. So another
That's
mystery.
interesting.
Yeah.
I've got a question for you. It just occurred to me. All the people in Northern Priory were quite young.
Yes.
So is it possible that they didn't get complications from osteoarthritis or bowing of tibias and things because they hadn't lived long enough to get them?
Yeah, I think that's quite possible. Osteoarthritis was quite rare is quite rare in the collection as well. You might expect it a little more even than we saw. So yeah, I think it's reasonable. We don't know a great deal about pre-symptomatic Pagets and the changes today as well. So yeah, the short answer is I think that is possible. Yes, perhaps changes are occurring before symptoms present clinically would be the lesson to learn there, I think. But it's speculation, I think, until we do the experiment.
Any other questions? All happy? Oh, yes, go on.
Thank you. Yeah, hello. It's been fascinating, thank you so much. From a personal perspective, I've been in healthcare for about 45 years, and I've learnt a lot today. What I'd love to know a little bit more about is the advice for people who are suffering from Pagets, what they can actually do for themselves, because there seems to be a little bit of a missing link. We've heard a lot about the healthcare, but not necessarily so much about the self-care, and we know that as people become active participants in their own healing journey, what is it that people in this room, and maybe who see the recording, can actually do for themselves to help their own situations?
Anybody want to take it? I thought you were done.
Yeah, I think it's general advice that you would give to anybody really about keeping active, keeping your joints moving, healthy diets. And we've talked before about Pagets disease making people feel isolated. So it's really about addressing those kind of things. The Pagets Association can obviously help with some of those things. We do have a network, we can put you in touch with other people, and we know that many people have made friends that way. You don't have to talk about Pagets disease all the time, but they've made friends. So, you know, if we can help in any of that, we will. But yeah, it's general healthy advice, I think.
Thank you. Anyone else want to add anything to that?
I think that's about
Right. Good, splendid. Is that everything? Oh, one more. Okay.
So, just to add to what you were saying.
My
My wife's consultant is actually Chinese, and he recommended doing Taichi. Is that something you'd...
Taichi is very good for stability, very good for central muscular control, reduces falls risk, and makes you less likely to break something. So if you've got a pagetic bone that's likely to break, then that might be quite helpful. But it's a good activity. We are now... Ooh, you've got 30 seconds.
It was very much following this gentleman's remarks, and in relation to research, that I think it will be, you know, in the future, it will be quite helpful and useful perhaps to look at interventions that they may benefit. And I mean, I do agree with Taichi and Qigong. There is already overwhelming evidence that it does has an impact on bone density as well, increasing, and it's coming all the time. So I think, and it's very easy intervention that it could be implemented across the patients. So it would be helpful to see more prevention across the research. Yeah.
So yesterday we had a board meeting here in Nottingham, and we agreed on our new research strategy, or refreshed our research strategy, and it's incredibly broad. And so we're not focusing just on basic or clinical research, but we wish to broaden and include things such as you've suggested there as well. So That's based on feedback from members as well, but it's really good to hear that we're in the right area. We'll publish our research strategy very soon, but yeah, we hear exactly what you're saying. I think that's very sensible, so thank you.
Now, one of the things we discovered when we were writing the guidelines is there's actually no evidence base for physical therapies in Paget. So occupational therapy and physiotherapy, although we all use them and our patients seem to get benefit, there's no evidence actually out there that it does. So it's one of the areas that we would be quite interested in developing projects on. And as Rob says, we've made it quite broad, our research strategy, and it does state that we would accept grant applications, not just from clinicians or basic scientists, but from paramedical specialties as well. So yes, it's broad, and we're aware of the need for that. That brings us to 3:30, and we're apparently supposed to close up. I hope you agree it's been a good meeting. I hope you've all enjoyed it, and thank you very much for coming. Anyone who isn't a member or wasn't a member before they arrived, hopefully they will be now. So thank you very much indeed, and may see you again. Thank you.